than 17,000 people a week becoming homeless for the first time in this nation. This is housing. That's something you got a right to be mad about.
The rhetoric is at a level that I haven't seen for years.
We have not done enough to express our own frustration at this crisis. The situation is not acceptable and we're upset about it.
None of it is okay. So if it's not okay for you and it's not okay for me, then what is the real solution?
We're trying to change the world, fighting for scraps. The public has a bullshit meter. Don't be afraid of authenticity. It will attract more people than avoiding the subject will. Today's guest, Marisol Bello, the Executive Director of the Housing Narrative Lab, Tom Murphy, the Director of Communications for the National Alliance to End Homelessness, and Tamera Kohler, who is Chief Executive Officer at the Regional Task Force on Homelessness. This podcast is a little different. It's mainly about communication and messaging homelessness to the public, to politicians, and to other nonprofits. It's getting crazy out there. I think people are beat down. One of the things that we've done in each episode is talk about hope. And so I do want to be authentic about some of the issues and challenges people are having and what's really going on. But we also have to frame it as a solution, like there's a light at the end of the tunnel, right?
Yeah.
And what are you seeing out there?
I'll start.
Yeah.
Being in San Diego, we're seeing what so many communities are, which is an increase in the number of people experiencing homelessness, right? And we're also seeing coming out of the pandemic, a lot of that funding now no longer in the community, and our markets are tight, right? Our rent is going up. That inflation is no joke in our big cities. We have a large unsheltered population, right? We're also seeing this tightening of our rental markets. So all of our solutions are just taking longer too.
Right.
And so I feel like it's the checkout line at the grocery store where it just backs up. A lot of discord around people experiencing homelessness. The rhetoric has been really elevated, I think, with an election year. And so it's sort of this triple whammy of funding being gone from the pandemic. We're seeing more people. It's taking longer. Things are costing more. And the environment is just somewhat electric. The rhetoric is at a level that I haven't seen for years. And I think that is the biggest concern that I have.
I don't think any of us could have predicted the narrative outcome. I don't know if I'm framing that right, because conversations that are happening post-pandemic, right? I think, people got scared. They're seeing more homelessness, and that's driving some of their thinking. And then you have politicians that are weaponizing some of that rhetoric to pander to voters. And you have advocacy groups that could be one person or 100 people, and nonprofits that could be one person that's doing everything, wearing many hats, or has 50 staff and one or two communications. And everybody is seeing, feeling a sense of urgency and seeing this rhetoric grow that's negative.
100%. I agree with everything you just said, Mark. I would add to something that Tamera was saying, which is this idea of both of the rhetoric that we're seeing and the impact it's having in our communities. And I think that because of it, with advocates, with service providers, the people in our space that are working to solve homelessness, there's a real hunger in that space and also a deep recognition that we actually have to tell the story in a much different way and connect the dots much more. So I loved how you were just talking about it, because when we talk about why people experience homelessness, the root causes are we don't have enough housing. People are losing jobs, right? Racial justice issues. Those are all root causes. We don't connect the dots enough to challenge the rhetoric, the harmful rhetoric that people are hearing constantly. But I will say that what I am seeing is a much greater hunger to address that, right? From all the people in our space.
One of the things that we're really struggling with right now is that there's a lot of unchanneled frustration and anger in the public right now for reasons that are totally appropriate, that the homeless services sector has always wanted to elevate the dignity and the humanity of the people who are experiencing homelessness as the very first priority. And I think that's not wrong. However, I think what we have not done is enough to dignify the frustration and anger, if channeled appropriately, is not inherently a bad thing. The challenge is that we are seeing it being targeted explicitly at folks who are experiencing homelessness, as opposed to being channeled towards the folks who are driving up rents, the politicians who have for decades not prioritized the housing crisis. Until we find a way to reroute that frustration,
Redirecting. I never thought of that.
we've got a real problem on our hands, because there are people who have far more resources and people who are, elected officials who it is very politically expedient to blame people who do not have political capital for this problem. Unfortunately, we're seeing how eager the public is to embrace that. So we need to redirect that frustration towards the people who are channeling those root causes.
And people that are pushing for criminalization and the people that are fighting against housing, they often reinforce harmful paradigms that have been reinforced for years. And then they say things like, we know housing is the best solution, but it could take forever. We need to help these people now. They spin it with a compassionate framing, and that's why we need to get them off the sidewalk into these forced camps.
Maybe a flaw in what we have done is that we have not done enough, is my opinion. We have not done enough to express our own frustration at this crisis. I think that we do need to find common ground with folks that this is an unacceptable situation. Because when we don't dignify those challenges, there are people who will say that we are aloof. There are people who say that we think it is okay for people to be cold and sick and old and tense. We need to lean into every conversation that the situation is not acceptable and we're upset about it.
I so agree with you, and I'm so glad that you brought that up, Tom, because it's one of these things where it's like, you know what? It's not okay for people to walk out of their house and onto the sidewalk and deal with some of the issues that come with people that are living on the sidewalk. And it is really not okay for people to be in the condition or be forced or be pushed into living on the sidewalk. None of it is okay. So if it's not okay for you, and it's not okay for me, and it's not okay for you and all of us, then what is the real solution? The compassionate solution is housing and services, making them available for the people who need it when they need it. That's the reality of when we want to talk about compassion, right? It's not forced camp. It's not arresting people or jailing them or making things that much worse. I 100% agree with this idea that it is important for us to acknowledge that it's not okay, because we also don't want to be seen as the people that are like, yeah, encampments are okay. We should have encampments. Like, no, we shouldn't actually have encampments. That's not a solution.
I've been doing this work long enough that when encampments were unusual, right? We didn't have lots of encampments. And now almost all of the conversation is about addressing encampments. And I feel like it is such a symptom of the entire way we have approached this issue, of so much of being very polite. We'll take what we can get. Thank you for that funding. That's never going to cover the scope and scale that we need. We don't hold any of the other systems federally accountable to contributing to it, not only in the way that we are underfunding housing or housing vouchers, but our social safety net is created for people to fall off of that. And our prevention programs have been non-existent. It's basically been proved that you need it by experiencing homelessness. And we don't have the same sort of rhetoric and accountability and frustration of the social safety net or some of our other things that would really prevent it. And it's so interesting that it's only when you get to sort of the homeless system that it seems okay to blame the very last system of care in this nation.
For every $100 increase in median rent, homelessness increases by 9%. Homelessness is a growing crisis, and as visible homelessness grows, the public is freaking out, rightly so, but they're pushing for criminalization. Criminalization of homelessness will only make homelessness worse. We need to support evidence-based solutions, which is why Invisible People's work is so very important. Please go to invisiblepeople.tv/donate and give a gift of any size. We need you.
And it's so interesting that it's only when you get to sort of the homeless system that it seems okay to blame the very last system of care in this nation, and that we don't hold any of the other pieces accountable. We have to elevate our voice, but we're not bringing enough of those other accountable people and systems to the table to be accountable with us. We'll never do it alone. And I think we've been really polite. We talk very government speak. We've sort of hurt ourselves in that narrative because we are not okay. We are not okay as an industry. We are not okay as a system. We are not okay with people being outside, exposed, aging, and struggling. And yet we seem to, in our narrative and everything else, be like, well, it's just about housing. No, it's about failure in everything and everybody having a measure of accountability. And we got to bring all of that to a place where we're really talking about how to fix the challenges we're seeing. It's more than just housing. It's sort of accountability at all these levels. And we'll never do it alone. And our messaging has really been about like, we know how to do it. We just need housing. Where it's more like an all call. We know how to do it. It's going to take all of you giving something beyond what the system can do.
I believe strongly, and it's probably because I come out of this world, which is fundraising, that a lot of nonprofit communications are based on fundraising. And it's because we're trying to change the world, fighting for scraps. Demand for support keeps increasing, the need for support, I should say, yet resources keep going down. So the executive leadership communications often falls under development, and that's always spun in a way, and raising money, you're not really telling the authentic story. I know we both very much agree on we have to be authentic. And I think that's partly why this has evolved. The other one is I see a lot of people doing busy work. And I'm not picking any one organization out, but you see a lot of housing and homelessness with nothing else there. We can solve homelessness. Okay, tell me how, right? Just saying housing is a human right doesn't do anything. I mean, it makes a nice t-shirt, that's fine. But when you're using it as an external communication piece, you've got to be more authentic. And okay, I agree, housing ends homelessness. Here's a story of Mary who is outside and now she's inside. You just can't leave it like that. But I can see for fundraising, that works great.
You name something it's been a big challenge on the provider level specifically, is that nonprofit organizations broadly in our sector has been very willing to invest communications behind development because you have to keep the lights on. Yeah. There's never enough resources. We live in, everything we're talking about kind of comes down to scarcity on many, many levels. Strategic communications has not been something that the sector has invested in until very recently. So I started my career 12 years ago in homelessness. Not exactly a veteran, but I'm not a newcomer either. And I was working in Washington, D.C. for perhaps the only provider that at that time was investing in a director level communications that was not in a development role. I think that was very much the norm for a very long time. And there was definite tension between the responsibility to fundraise and to support fundraising and the responsibility to communicate a vision for the next 3 to 5 years for the city's work to end homelessness. I raise all that to say that, these are not skills that our sector has been developing for a long time. I think there are tremendously talented people working in the sector right now, and they're working within an ecosystem that has tended to view communications through a very different prism. So that creates a lot of tension. I think it explains why private sector is very sophisticated at are things that we're still trying to get our training wheels off on.
What I see a lot, and it's not necessarily nonprofits, it's often politicians, we've got this 40-unit building, we've ended homelessness. And I don't know if you know Mark Dones. Mark Dones, when he was running King County, he would be in front of that 40-unit building and he would start off and he would say, 40 units, it's something, it's great, but we still have a lot more work to do. If there's a way to figure out as nonprofit communicators how we can celebrate the small victories, but at the same time, not creating distrust, right? Because we do the ending homelessness, ending homelessness, ending homelessness. And that's been driven by fundraising. If we're not ending homelessness, nobody's going to give us money. And then the public sees homelessness growing and no, something's wrong here.
Well, I'll tell you, one of the things that I think Tamera's community is doing so well is that in your communications, you are really not shying away from the deficit, from the things that are needed. And I think that is the framing that's required when you have 40 units.
The good, the bad, the ugly.
You need to be able to demonstrate within a context of how many units that are needed. And sometimes seems like those are figures that we are uncomfortable talking about.
Yeah.
But I think that what's happening with the regional task force in San Diego is really brave and really strategic in terms of like putting it all out there so that you have a context for the good news and a context for the bad news.
For the people that are listening might not know, and there'll be a link down below, you have a dashboard that's publicly acceptable that people can look and get almost real time, or is it monthly?
Monthly.
Yeah.
Yeah.
So monthly they get an update, and reporters share it out, and I'm sure other people on both sides share it out. There's a level of transparency there.
And it's interesting. Everybody finds something in it to share it with, right? Like our electeds pick up on it, right? Our press does, because it's literally every month we're looking at how many people are new to our homeless system. So that first time they're touching our system, and then how many are housed each month. And then there's a whole bunch of other information in there around seniors and families and the TAY population. We sort of pull back the curtain and show what are the housing resources that were utilized. And a lot of them are being housed not with the permanent supportive housing that we all talk about, but with a little bit of rental assistance. Some are moving back with family and friends. Like we pull all of that back.
They restabilize on their own.
Right. Shows that the system itself has the ability to connect with people and in those individual experiences of homelessness. But it also shows just the overwhelming demand, because we also show it by subpopulations where we're having greater success and other populations that are not getting housed at the same rates as well. When we measure month over month what it would take to have a system that is actually meeting the need and scale, it's only when we open a very large development that I'm able to house the same sort of numbers that are coming in each month. So we've got almost 2 years now where we're having more people coming in that are experiencing homelessness than we're housing. What's great about it is it takes some of those arguments of, that we can't end homelessness, or we don't know how, or that we'll never build our way out because we'll never get that much PSH. And it really breaks it down into, it does happen every month at a scale. I mean, we house more people in San Diego, but I will say a lot of the homeless individuals are figuring out how to house themselves. Yet our numbers of people experiencing homelessness, and so much of that is economic. It is an immediate crisis. It is health. And so it's allowed us to really show where our weaknesses are, where some of our successes are, that not all populations are treated the same. The disparities that we see in race, that, our population in San Diego, although not in this report, is only about 5% of our population are Black San Diegans. And yet it makes up 30% of our sheltered and our unsheltered. And so they are having a much more challenging experience, not only losing housing, but then getting housing. And it just changes the conversation, not so much about individual providers, so that kind of competition for the narrative to get the funding is more about this system is overwhelmed, and yet there's successes and there's some real weaknesses in this space. And what does that look like? And it's a great narrative starter, a shifter of the narrative, but it also allows us to have different conversations as you pull pieces out and sort of look at it. And Mark and I have talked about, it's given us some fertile ground. Now, how do we add the narrative and the real person's stories into it so you get a real picture, which I think just adds more color and more of the human space. But the report really turned down some of the heat. Now, we still have a lot of rhetoric. We have a ton of rhetoric. But it's been a really powerful thing. But we sort of just looked at it very differently than we have in the past.
You have one line that I think is really powerful because it recognizes the successes, but acknowledges the challenges, which is for every 10 people.
Yeah.
Yeah.
So
can you talk about that?
You don't realize how important it is to have a simple narrative, right? A one sentence. And through looking at the data, we found for every 10 people that were housed, 13 more experienced homelessness for the first time. Now we've just redone the data. It's now 16.
16, that's right.
Yeah. So for every 10, 16, right, are experiencing homelessness. It is so easy for the general public to grasp that picture. Also our electeds to talk about what they need to do. It has allowed them space to talk about housing. What we need, kind of to the point of 40 units is great, but it's a drop in the bucket. It allows us to then say it's a drop in the bucket because here's all the numbers. Right. We know.
I'll tell you another piece of data that I've got a little bit obsessed with lately as I was looking at HUD has all these complicated reports, and the system performance measures is the one. And I think for 2022, it said about just under 900,000 people entered into homeless systems for the first time that year. And I started playing with the math there because 900,000 is just too big to make any sense of. So I divided it by 12, and that was a big number. And then I divided by 52, and 17,000 people a week becoming homeless for the first time in this nation. When you think about the narratives that drive the public connotation of homelessness, that is far too many people to chalk up to addiction and mental illness. And that's not to say that we don't need to get real serious about how we talk about addiction and mental illness, but 17,000 people a week for 52 weeks, this is housing.
Yeah.
This is rent. And if you want to be mad about something, that's something you got a right to be mad about.
Very much so. In fact, that's the first time I've heard that. And that's a whole story in itself to be, unpacked. For me, an invisible people, we've always done the good and the bad, the ugly. I have a friend, Chris Brogan, and writing partners, Julian, wrote a book called Trust Agents. Everybody here is probably, do you guys know who Robert Scoble is? Robert Scoble worked at Microsoft, and Internet Explorer really sucked. And Microsoft allowed him to talk about that. People are like, he works at Microsoft and he's saying out loud what we already know. We can trust him, right? It's that authenticity builds trust. They're going back to how we've been, mostly underneath fundraising, saying we're ending homelessness. We haven't talked much about the inflow. We haven't talked much about how we need to prevent homelessness. We've always painted ourselves as the heroes. As chief marketing officer for a large nonprofit, you have to say you're ending homelessness, right? We have to pivot to where we're talking about that. Also, at the same time, I've always said you have to be authentic about social crisis, but do it in a way that there's hope.
Yeah.
We agree.
Yeah. Well, I think we have these big numbers, right, that we talk about. I'll just say in San Diego, on average, it's about 1,200 people a month new to the homeless system. So if you do the math, it's about 300 a week. If you get stuck in that, there is zero hope. Mm-hmm. Right? Like that is a big number, even though we are a big community. And the truth is that although it's a big number, those are the people that we're getting our arms around. That means we've got data on them. That means someone's connecting with them. That means that even as complex and as challenging as those numbers are, we are connecting with them and engaging and really leaning into that first time homelessness. Like what's that rapid response that we could do? Because we've always been not only looking at the housing, but we've also looked at the most vulnerable, right? And we're focused on that high need. And it used to be because those were the most expensive. And I think today it's both ends. We've got to work both ends, right? So if it is that first time, can we do something, small amount of money, pick up the phone, talk to your landlord, do all of the diversion, the prevention work, because the numbers are so great. There's a large expense going for emergency, like shelters and outreach and all of those things as we work on the permanent supportive housing on those of the higher end. And we have to talk about and think about it differently. That's the piece, as we've sort of started changing our narrative to talk about it. Housers are like, no, because we still need money for permanent supportive housing. And I was like, you do. You got to book in both. The truth and what builds trust is talking about not everybody who's experiencing homelessness needs the same level of supports. Mm-hmm. Not everybody needs to wait till they become so traumatized, so brutalized by their homeless experience that they are ill enough, that they are at a place that now it's become disabling. And now we're going to house them. And I think when you talk about trust, part of it is really talking about we're not rapidly responding and changing in a way that has matched the need in a lot of ways. And so how do we do that in a hopeful way? And I think the best hope comes from seeing it, recognizing it, saying it, because I have had an incredible opportunity to be with my outreach teams, and you talk to people experiencing homelessness, and there's a big difference in that first bit when they're experiencing homelessness. And their thought process is to get back where they were. And the longer that they don't get assistance, then they turn into, how do I survive this? How does this become? Yeah. And so I think that hearing that there's an opportunity and building trust with our providers in the system, with people experiencing homelessness, we hear that, we see that. What's the action that we can take? And I think that space is the space we have to live in today, right? Because there's no way we're going to get 300 people into permanent supportive housing. But if I can work with that 300 to get a third of them maybe back where they were at, or the courage to have that conversation with the family member, or all those other things, that is money well spent as well and reduces their level of trauma. Yeah. And that trust and that truth has to be that we're willing to talk about it differently, because it has to be a yes and, right? And we too much, to your point, has been ending homelessness, permanent supportive
making
housing.
Ourselves the hero.
Yeah.
But how do we lead the way for nonprofits or even advocacy to be more authentic?
I think that to a lot of what Tamera was just saying is collaboration, coalition, finding people that are maybe thinking slightly differently than you. Like, where is the place where we have a shared value, or we agree on something, and then building from there, even if yet we don't agree on everything.
Some of the most hateful and toxic narratives that exist on homeless right now are spreading because people in bad faith are positioning them next to shared values. And I mean the shared values that we want safe communities. And these people are unsafe. So we have to get rid of these people, right? That we want order. Well, everybody wants an orderly community. Well, these people are disorderly, so you have a vested interest in getting these people off the sidewalk. You want public spaces. Well, we all want public spaces, so we need to get these people off our public spaces. That is shared values. It's just done in bad faith for bad purpose.
We talked a little bit about this the other night. There's a bit of invisible people that I have run by a boss who would never let me do it. It obviously works. For example, and I come out of response television fundraising infomercials, I developed a strategy for a format that you would do a success story to validate that you can solve the crisis, that you can help these people, because that's great. But then people often will detach and say, oh, they're doing it. I don't have to donate money. Look at, they're doing it. So I got this system that I knew would work, where you would end with a story that showed there's more work to be done, that we didn't solve the crisis. Like, look, we helped these people. It was wonderful, but we need to help these other people. I experimented the best I could, and my bosses always went, no, we just want success. Well, you're telling me to get more donations. You are kind of shooting yourself in the foot. You need more stories of homeless people. And I learned the difference between stories of homeless people and stories of formerly homeless people. And they're both important, but in different ways. Stories of formerly homeless people validate the work. They say, gosh, we can solve homelessness. That's great. And stories of homeless people build the empathy where people say, oh my gosh, we got to help her, right? And they're both important. But for invisible people, what I just naturally did, okay, everybody's doing success stories. I'm going to do the other story that nobody is doing, right? And where I'm going with this is basically the good and the bad and the ugly. And you'll see in our Helsinki documentary where you see the kid with the messy room, and it's communicated very authentically. This is what housing first really is. Some people don't get better. Some people could take years to get better, but they're at least in housing, and you've ended their homelessness. And we have done documentaries. The one that comes to mind is we did one in Venice, and producer Alex messaged me, do we talk about the addiction? Do we talk about the mental illness? Because it was very candid what people were saying. We thought about it and had some back and forth. If we avoided that, it wouldn't be authentic. So we left it in, but we messaged housing, 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 even though there was the message of mental illness and addiction that was very real. Like one gentleman says, I want to get high, that most nonprofits wouldn't even have in. Then we followed it up with a story of somebody in housing. So my advice for communicators, don't be afraid of authenticity. It will attract more people than avoiding the subject will. I think that's extremely important. The public has a bullshit meter. And if we're saying this is the solution, they're always talking about addiction and mental illness. We have to really address it and not skirt the issue, because then they're not talking about it. Yeah.
And And there's a nuance to exactly what you're saying, which is when we are telling those authentic stories, because there is such a deep and harmful narrative that if you are experiencing homelessness, it's your fault.
Yeah.
It is your personal responsibility. You have done something wrong, right? Or there's something wrong with you. The piece about the authenticity that is important to highlight is the systemic challenges and the systemic root causes that force people and push them onto the street. And so your point about people being real about their issues and talking about housing, or also talking about their issues as root causes, because sometimes people will also internalize those bad narratives themselves. Yeah. We know they'll tell you a story and they'll talk about the thing they did, but meanwhile, they were in foster care. Meanwhile, they lost a job, right? They're like, meanwhile, they made $7 an hour, but their rent was $3,000 and they got evicted. And you're like, I'm feeling like there are some systemic things happening here, some root causes that are not about the choices that you've made. There are some things there that really, there maybe were risk factors that you had, right? That I think are important to highlight as you are talking about. Helping people understand the systemic causes, the systemic root causes is important to being able to also tell the story.
Scream that, because we're trying to do more tent to home stories. And the stories we're getting are from homeless people that contact me and say, hey, I'm moving into an apartment. And I've offered nonprofits. We have a really good production team. We have a following of 2 million. We'll do free of charge. Just let me know, because it usually takes a little while. You get a couple weeks.
Takes a bit.
It takes a bit. We'll fly in, and they won't, because I want to talk about systemic issues and they want a fundraising piece. And I understand where that's coming from, and that connected to what we're talking about, that's the change.
Well, and I will say that's just not authentic. When we talk about, and I get in community meetings and people say, they all have mental health issue or substance use issues. And I always say, the majority of people with mental health issues are housed. The majority with substance use issues, maybe your neighbor, they're housed. And if we really want to let's just get real. We have them in our own families. I have them in mine. And if we want to understand the challenges of challenging childhoods, of generational health crises, right? Of systemic racism, of rarely do you run across someone who experiences homelessness that when you really sit down and start talking to them, you understand the root causes, or many times they don't have some of the things or reasons that people will never experience homeless. The privilege of, having enough money, whether you work for it or you inherit it or whatever it may be. The privilege of having family members that own homes because you can move in with them, and you can't do that in a rental property, right? For some, it's the connection of strong friends that they have. And yet when you grow up in a very traumatic childhood or experience, you also don't have all of those connections or a stable family to really support you. And then your family may have a history of health issues, right? It's not just cancer. It's not just heart disease. Mental health and substance use are health issues. And so I think if we're so afraid to talk about it in a way that then that fear, I think, shows up in how communities are fearful of us housing folks. If we can't talk about it, they're never going to be comfortable with it. And so I think we have to show up very comfortable in that space. Yeah. The advantage of having someone who's had these issues be housed is their care level, their own personal safety and safety to community. But let's be honest, most of us have that in our families anymore. You're going to struggle to find someone who doesn't have a family member, if not immediate, that has a mental health issue or substance use, whether legal or illegal. And unless we start just normalizing it and take that off the table, we're always going to struggle. What you're saying about authentic, right, messaging, you got to tell the whole truth.
Good, the bad, the ugly.
Because people, like you said, they do have a BS meter. And when you lead with some of that, then it's like, now we're not going to have that conversation because you're not going to accuse me of not acknowledging what I see and I know. Yeah. And when you sort of get that in that conversation, it changes the conversation, because most people want to be like, yeah, I do. I actually have that in my family.
If you had 3 wishes, what would they be?
Housing by right. We need more housing developed and built, not because people are buying it, but because the need is there. The second is to really normalize all of the challenges that everyone experiences. So when I was talking about mental health, substance use, if I had a magic wand, we would just remove that from the narrative, because we all got our our baggage. And my third would be the hope and the belief that this is a great nation and that we can have thriving communities that have a place for everyone. And the care level that we have, that's why we have the social safety net. If we get back to really taking care of those who truly can't do until they can for as long as they need it, that would be my hope, is that we could get to that space. And I'm still very hopeful in this work. As cynical and as jaded, and as long as I've done it, I'm still really hopeful.
I would like to be able to help people understand further how housing is so fundamental to everyone's personal and community success. Like, if you do well, I do well, right? Because we live in the same community. The second kind of applies, but not only for housing. I just feel like we live in such a polarized moment in time that I think it's really having a hard impact on our people, both the people that are living on the street and the people that are working so hard to help people not be on the street. And I think so many of us are struggling in this work. My wish is to figure out how folks can find what they need and remember why we're here, right? Beyond the hardship. It's actually because we don't want people to be in this hardship and in this challenge and in this space. I would like to remind our friends and family in our work, our colleagues in our work about that. I don't know that I have a third.
I would echo what's been said about housing by both of you. This is going to sound, as someone from Washington, D.C., this is going to sound very much like something someone from Washington, D.C. would say. But we are 40 years overdue, 50 years overdue on housing being a domestic policy priority. It is not a priority. It is an afterthought. We are living with the consequences of that. So that my first wish would be housing to be a domestic policy priority. In terms of, I think where my mind is right now is on the field. I wish so desperately that the people who are doing outreach, the housing navigators, the outreach workers, the frontline workers, I wish so desperately that they were respected in their communities for their work, which is life-saving. It is as life-saving as those of first responders. It is important of those as nurses or teachers. Many of those professions also are woefully underpaid, and that's a symptom of a broader crisis we have in our nation of what we value and what we don't, who we value and who we don't, and which jobs we value and which we don't. And then I think for within the context of this conversation, I wish that we could arrive in a place of where we had a truly more sophisticated understanding of what it takes to persuade people and to bring people to open their mind on ideas that might not immediately intuitive to them. And I know what that's going to demand is that all of us stop saying the things that are satisfying and the things that lead us to high five one another and say, yeah, we said the thing that matters, when in truth, we're really saying the things that make us happy. And we're saying that at the expense of framing what we have to say in such a way that people who might not immediately agree with us could take a pause and consider that perspective.
Well, thank you guys for spending some time with me.
Thank you,
Mark, for inviting us.
Thank you, Mark.